Thanks for having us here. So just to let you know that I'm going to show some slides, mainly is PowerPoint. Don't be afraid. A lot of people have this perception that when it comes to heart surgery, it's a 50-50 thing, and that is not true. Unless you collapse outside and the CPR is ongoing and bring you to the hospital, then the risk is very high. Otherwise, the risk is only 2 to 3% if you come early. Yeah, and it's just for your info, it's the commonest surgery done in the world. More commoner than even appendectomy, more commoner than even breast cancer. Yeah. So these days, a lot of people are in the perception that cancer is the #1 killer in the world, which is not true. The #1 killer in the world actually is coronary artery disease, or what we commonly call as heart disease. For us, the medical term is coronary artery disease. Okay. So basically, I'm from Singapore. I'm a Malaysian. I was working there for about 15 years in Singapore, in Australia, in Berlin, in Germany. So finally, I decided to come back because of some personal reasons, old parents and things like that. And I found a suitable hospital that I think could accommodate me and able to do most of the things that I've been trained with. Yeah. So this is the important slide that everybody must know. That a lot of us think that cancer is the commonest, as I mentioned, but actually it's not true. Across all ages, the commonest is cardiovascular disease. Cardiovascular disease doesn't mean it's limited to the heart. It starts with the heart, it can affect the brain, your legs, blood supply to the legs and things like that. So, if you look at this, a lot of us are in the perception that you only get heart disease when you're 60 and above, which is not true. In Southeast Asia, especially Malaysia, Singapore, Vietnam and all the other ASEAN countries, we are actually at the lower age group of getting this disease. Yeah. So we start, once we are 40 and above, we are already at risk of getting this disease. And if you just leave it alone, there are many problems that can come without early detection and treatment. Yeah. And if you go to Japan, of course, Japan is all 80 and above because they are relatively healthy and they have good genetics, so they live very long. Yeah, as compared to Southeast Asia. And there are many types of heart diseases. Okay, basically the commonest is this, as I was mentioning, coronary artery disease. So maybe you or your friends may have come across relatives or newspaper readings or social media postings. Somebody's got a heart attack and gone for a surgery or got a stent or a balloon inside. So that is referring to this coronary artery disease. This is the commonest. The second, of course, is valvular heart disease, which is called valve disease. There are about 4 valves in the human heart. Basically, they function as a door, one-way traffic, where the blood will flow and then it doesn't come back. It's just a one-way traffic, yeah? And the other, of course, there are some major blood vessels arising from the heart. If you can see, this is the heart. There's a major blood vessel called the aorta. So this one can get swollen, or the medical term is called aneurysm, or it can rupture. So this is also quite common, especially in people who've got high blood pressure who are not well controlled. Yeah? Or you've got a family history of sudden deaths, then you must suspect of something called aneurysm. These last 4 diseases are not very common in Asian population. They are mainly in the Caucasian, so there's some good news. But lately, if you read the literature or you look up on heart disease on social media, this is becoming very, very rampant, heart failure, because the incidence of diabetes is very high in Southeast Asia. So we do not have the classical symptoms of pain that we go to the doctor. We generally go into heart failure, where the heart function from a normal 60% drops to 30, 50, 40, 30, 20, and 10%. This one is arrhythmia called a condition wherein the heart rhythm is not regular, so you keep on having palpitations. So basically, this can be treated very easily. Yeah. And the last, of course, is cardiomyopathy, where you have a genetic problem and you probably need a heart transplant for this kind of conditions. This one is inflammation of the heart. So if you remember, in Singapore there was SARS, so many people were dying. So half the world thought that the death was due to the lung failure. Actually, the death is due to the heart failure because the virus infects the heart and the heart cannot pump as normal. So we have to put them on a special kind of machine, and the outcome is usually quite poor. Yeah. Okay. So this is how the heart looks like. Yeah. Basically, the arteries are on the surface of the heart. If you look, there is one on the right side and the 2 major ones on the left side, one coming in front, one going behind. So the 3 share 100% blood supply to the heart, and they are only on the surface of the heart. They are not on the inside. When you talk about the valve is on the inside of the heart. So there are 4 valves, the blue and red. Basically, there's a wall in between and the blood doesn't mix. So the red side, there are 2 valves, and the blue side, there are 2 valves. Okay, so they all, if you look, the arrow is just one way. There's no 2-way entry. So everything is just one way here. So the moment you have 2-way, the blood with the oxygen and without the oxygen starts mixing and you have problems in the heart. So when we do operation on the heart, when we talk about arteries, we are actually only operating on the surface of the heart. We are not opening the heart. But when we talk about the valve, we are going inside the heart and are doing the necessary procedure. Alright, so this is roughly how your heart looks like in the operation theatre. Yeah, it's the size of your fist, and the coronary arteries are actually on the surface of the heart. So we can locate them by special spectacles we wear, which is about 3 to 5 times the normal power. And if we can't locate them, we got special instruments to locate where the arteries are, because sometimes there's just too much fat on the surface of the heart that we cannot locate these arteries. Yeah, and the valves are actually quite standard. They are inside. They are approached through a cut on the surface of the heart. So this is the distribution of the heart diseases. As you can see, coronary heart disease, the commonest is 52%. Yeah, the rest are less frequent. The one you read in the newspapers with heart in the hole and things like that, they are congenital. They are pretty rare. They are about 5%. Basically, they happen in kids who have consanguineous marriages among the parents. So that is pretty high. Or you have a late marriage and a late childbirth, so the chances of getting heart disease is pretty high. Yeah. So how does the artery look like on the inside? On the inside, it's supposed to be smooth, just like your face. Yeah. Very smooth, no problems to the traffic flow of the blood. It should go one way, like this. So once you start having problems, you can see the blood supply to the heart, because the heart is like a muscle. All it needs is blood supply, and there's oxygen and food inside the digested blood. So without enough blood, the pump will fail. So when the pump fails, you get all sorts of problems. So basically, you want smooth flow of blood through the arteries. When it gets blocked, you get problems. Yeah. So this disease of the heart blood vessels, in the medical term, is called coronary artery disease. Yeah. Okay. So you got 3. All 3 can be affected, or either 1 can be affected, or 2 can be affected. Depends on how severe the disease is. Yeah. Okay. So basically, what do we have when the diseases are blocked? So commonly we talk about chest pain. So everybody thinks if you got no chest pain, you got no heart problem. That's not right. Yeah. A large group of us are actually sitting in this zone, no symptoms, no features. The reason is because most of us here in this ASEAN region have very high incidence of diabetes. So once you have diabetes will not show up with the pain. It will show up with this, swelling. Sometimes you feel tired, sometimes you have difficulty in breathing, and you've got reduced exercise activity or tolerance. So for example, a marathon runner who's running 42 kilometers every now and then, suddenly he says, now I can't run 42, I can run only 21. So if he can run 21, that means he's got a problem. Yeah, so that he needs to be treated. So previously, when I was working in Singapore, the hospital medical legal team, the main guy there and his wife, they are both avid marathon runners. Every month they are either in Japan, New York, London, you name it, all the marathons they are there. And they are very, very skinny, no fat, no nothing. But he was running marathons, and suddenly he said that I can't run the full marathon anymore. So he came to us. When we checked him, he had heart disease. The reason he got heart disease is because of 2 things. One is very strong genetic family. In his family tree, everybody's got heart problem. Number 2 is all these marathon runners or any of you who exercise, the biggest thing you do is after you exercise, you start binging. You think that you must pay back all the energy and things like that. That is really bad, and that is wrong. You should never do that. So you have to do it gradually and normally, as just like any other thing. So the body will learn how to adapt. It's just like an example, like when you run a marathon, it's like you have not eaten for the last 5 days. You start to put in everything, the 5 days food. And when you put in too much food, the body cannot process the fat and the cholesterol, so it gets blocked in all these vessels. Yeah. And then you start having this problem, difficulty in breathing, tiredness, reduced exercise activity and things like that. Because after a marathon, all the organs of the body are tired, so they need proper way to recover and a proper time to recover. So a lot of people are not aware of this. They, for fun, they join a marathon, they join half marathon, they join a 10-kilometer run or 15-kilometer run because they want to lose weight. They're not doing it the right way. So then they come back after 6 months or after 3-4 years and say, Doctor, I've been running marathon all the while, how come I got heart disease? The problem is this, because they do not know how to replenish their stores in the right way. Yeah? So you should do it very gradually and not overeat. Doesn't mean if you run a marathon the next day you can eat 10 roti chana or something like that. It's not right. Yeah? Yeah? That's very important. Okay. So what are the risk factors for this heart disease? Of course, all of them act together. There is no one that is causing the disease. I'm not against smokers. I got nothing against them, but just to tell you some medical facts. If you smoke, the chances of you getting heart disease is pretty high. And if you've got hypertension, diabetes, cholesterol, you do not exercise, or you're a bit obese, and you've got a family history of heart problems, then you have to be aware that you are at the risk. Now, a lot of us have these problems, hypertension, diabetes. It's like having a common cough, cold, flu. Everybody in the house has this. And religiously, everybody takes pills, but nobody goes and checks whether the control is good or not. So if you've got diabetes and you keep on popping on pills, but you still go and eat your kway teow, your mee goreng, and then you do not check your blood sugar to make sure that it's in the optimal level, there is no point taking medicines. The effect is still there. Yeah. And the biggest plus point about diabetes, for the past 3 years, there is actually a cure for diabetes. This is a breakthrough by a very big research group in Singapore and UK. All you have to do is you have to lose 15% of your body weight. So you exercise every day and you can lose 15% of your body weight. It will take you about 8 weeks, and you control your diet. You can come down or even stop on your diabetes medications. But of course, once you come out of the diabetes zone, you have to monitor it very regularly, because you are at risk of jumping back into it the moment you gain weight. Yeah? And cholesterol is important, that you control it, and exercise. Now, a lot of people think that you want to be fit, you have to really be somebody like Lee Chong Wei, or you have to be somebody like, some Usain Bolt or something like that. That's not true. You just require, for an Asian male or a female, you just require 45 minutes to 60 minutes of walking every day for 5 times a week. That's more than enough. Yeah, 60 minutes, 45 to 60 minutes. The Americans need 30 minutes because their genetics are such, but the Asians need about 45 to 60 minutes of walking. And walking doesn't mean brisk walking or whatsoever. It's just normal walking with your iPod or whatever. You want to hear music, you can just walk around your area or walk on the treadmill or anything like that. Yeah. So that's the most important. And of course, when you go on the treadmill, it is not the kilometers or the distance you have covered. Your treadmill must tell you the calories that you have burned. That is the most accurate. If your treadmill doesn't have the calorie meter to tell you how many calories you have burned, then you can walk 2 kilometers, 4 kilometers, 8 kilometers, not going to help. Yeah? Okay? So this exercise is very important. Yeah? Okay?
How about swimming?
Yeah, anything that's 45 to 60 minutes is good enough. Yeah, you do it 5 times a week. Yeah. If you go to the American Heart Association website, they will advertise it as 30 minutes, but that's research done in Americans and Caucasians, not in Asians. Yeah? Okay. Now, this is something about smoking. So a lot of people who smoke claim that if you have a filter, you'll be less at risk compared to a person without a filter. That's not true. So whether you got filter or no filter, your chance of getting a heart attack once you're smoking is pretty high. There was the youngest patient I've operated is 28 years old. He started smoking at the age of 16. So 12 years later, he was like 5 boxes a day. He became very addicted. He was in Singapore, and we operated on him when he was 28 years old. He's still okay and managed to quit smoking. So that's important. Once you get the disease early, it's very aggressive, and you will need at least 3 or 4 bypass in your lifetime. That means 3 or 4 redo surgeries. Yeah. Okay. And this is hypertension. Sorry, the slides, because I don't know why the computer, it doesn't come up. But anyway, the message is pretty clear. If you have high blood pressure and you do not control it, the chances of getting a heart attack. So it becomes higher. Yeah. So you must make sure that it's well controlled. Yeah. Whether it's male or female. Now this is very important, genetic. There are 2 aspects of genetics. One, you must have read in the newspapers or you've seen the TV or movies or things on social media and things like that. People dropping dead on the football field or during marathon and things like that. The reason is because they have all these different aberrations in their body. They have funny conduction ways. So when that happens, what happens is that the heart generally generates an impulse or beat. So the beat is not regular. When the beat is not regular, it can go faster than normal, and the heart can stop, because the heart is a pump, it gets tired. If you go above 160, you definitely stop or tired. Yeah. The other, of course, aspect of genetics is in your family, especially for the males. If your father has heart disease, the chances of you, if you're a male, having the heart disease is very, very high. It's 52%. So that means once somebody in the family has heart disease, if you're a male, you have to start taking care. Taking care means make sure that you take care of the risk factors, you do some exercise, and you watch your diet. That's very important. And just to inform you that Sunway has this genetic screening done. Blood test available. It's not available in any private hospital in Malaysia except in Sunway. So if you want to go and get it tested, I think it's about 2,400 ringgit, but I don't know whether there's a staff discount. I think there's a staff discount, I don't know. I'm not selling it, I'm not doing it. So you can check it out. Because I saw it on the lift, so I thought I'd share it with you. Yeah? Yeah. So this is very important. So if your father has coronary artery disease or heart problem, you have to take care. If you have a history of sudden death in the family, then you have to go for a screen early. The target is 40 years and above. Once you're 40 and above, you're already at risk. So you must go and get yourself checked. Yeah? Okay. Now, this is the incidence in men and women. So generally, men win over women, at least in this case. But just to let you know that the women are protected up to menopause because you have estrogen in you. So no matter what you do, unless you're a very heavy smoker or you're severely obese, got a strong family history, then you get into trouble. But generally, you do not get into trouble until you're about 55. That's where you get menopause. After that, probably when the estrogen is low, then you're at equal risk with men. Yeah. Okay. So men, you start at the age of 40 itself, you're already at high risk. Yeah. Okay. So when we talk about coronary artery disease, as I mentioned, it's not just affecting the heart. It can affect you to get a stroke in your brain, or sometimes it can affect your arteries in the leg. So you see some people walking around, swollen legs and got wounds that do not heal. That means their blood vessels to the legs are all affected by this disease. The disease is actually arteriosclerosis. This is a medical term. Yeah? There is no cure for this disease worldwide. It's just control of the risk factors and trying to delay the progression. So that's very important. Yeah. So this is how it looks like on a microscope. By right, it's supposed to be clean here, white in color. But once you get the progression of the disease, it becomes full in the center and it's all disease and the blood cannot flow basically. So it basically is the heart that is lacking in blood. Once there's no blood going to the heart, the problem starts. Yeah. So this is the progression. So generally when you reach this stage, you will have some problems, but medical therapy will help you, don't have to do anything. When you reach this stage, you probably need an intervention, yeah? So probably a stenting or surgery. But when you reach this stage, you're probably in the ICU or the CCU, and probably on some machines and some medications to help you go through this phase where somebody must quickly open up and clear up all this, either with a bypass or a balloon or a stent to get the blood going to the heart. Yeah? Okay. So what do you do when you go and see the doctor? The important thing is to check for the risk factors. Yeah? Check your blood sugar, check your cholesterol, check your blood pressure, and of course, where facilities are available, genetic testing. Yeah? Okay. And if all these are abnormal, or one of these are abnormal, or you're really worried, you can go for a treadmill. Treadmill is harmless, but treadmill is not the most accurate test to detect this heart disease. I give you an example. For a person who's running a marathon, he can pass the treadmill easily, because treadmill is basically running on a treadmill with some ECG electrodes attached and blood pressure monitoring. So anybody who's very fit, who exercises daily, can pass this test easily. Yeah. The gold standard is angiogram. Now a lot of people are afraid of this. The risk is only 1% that anything may go wrong. Yeah. So if you take a plane, the risk is more than doing an angiogram or a heart surgery. Yeah. Echo is to detect the heart function. If you don't want a prick, then you can get a CT scan. The CT scan has got its limitations. It's up to about 55, maybe 60 as the age limit. Because if you age too much, there is calcium in the body, so that will interfere with the interpretation. So you may get a false interpretation. So this is how a stress test looks like. You just go there and wear your sport shoes and do the jogging. So there are leads attached to your chest that will detect any abnormality. And of course, there's a blood pressure monitoring with this scan. Yeah? But as I said, this is not the gold standard. You may not pick up in a very healthy individual that runs or exercises regularly. So this is what we call angiogram. Sorry. Previously, we used to do it through the leg. Sometimes we still need to do it depending on the condition. But most of us now can do it this way, through the hand. Okay. So you put in a wire, you inject a contrast. The wire is here, then you can see, engage the coronary arteries, and you can see which vessel is blocked. The risk of this procedure is 1% that you may go into problems, including death. So there's a 1% risk. Yeah. So once you do this, this is the picture you get. Okay. So by right, it should be clean like this. Okay, if you see the top, this is clean. But here you see there's a narrowing. So this is disease. Yeah. If you look at this, there's a narrowing here. So this is disease. Yeah. It should be clean. It should be clean like this. Yeah. And here, there is a blood vessel that is completely blocked 100% here. It's supposed to come down here. So I can see it because I'm experienced and I know this field. We probably won't be able to make out. But there's a block here. There's a block here, yeah? Okay? Alright, so when you go to the hospital, if you or your relatives or anybody who's got, or friends got a problem and the angiogram is done, it's only, I think, right that you ask the doctor that you want to see all the splints and ask him to explain to you. But this is very, very important. Do not think it happens in Malaysia, but in countries like Indonesia, Vietnam and all, there's a lot of cheating going on. So they do not show the patients this, they show them different images that represent different disease, and they charge them and accordingly for that. So in Malaysia it does not happen. Yeah, but in other countries it's pretty rampant. Yeah, so you have to be careful. Yeah? So when you get this, generally your name will be printed up here, your IC number will be printed up here to avoid all these funny things going on. So you can check to make sure it is yours, and then ask the doctor to explain to you, rather than just taking it one way. Yeah. Now, for those who do not want to do an angiogram, you want to go for screening. This is a relatively safe test. This is a CT scan. So basically, you go in the machine within, I think, 26 seconds. You're out, and it's painless. The only thing you need to get some contrast injected in your body. So the contrast will light up like this in the artery, and you will show that if there is blockages or if any disease. The problem, of course, is calcium. So if there's calcium, then it may interfere with the interpretation. So that means you have to go back to this. If there's calcium, then you have to go back to this one. Yeah, this one is 100% accurate. Of course, the technology is now advancing more and more. Initially, it was 32 slices, then it's 64, then it's 128, now it's 256. Yeah, so you can see all the arteries like this, whether they're clean or whether they're affected. Yeah. So once you get a diagnosis of heart disease, what do you do? Basically, there are two spectrums. If you are stable, you seek treatment, you can discuss and do whatever you want to do. If you're unstable, you need urgent treatment. So unstable means you have seen, friends or family or anybody you know, they're basically in a term called shock. So they are in the ICU or in the CCU, critical care, so they need all sorts of medications and help to make sure that the heart comes out of the shock situation and can go for the next step. So once you're out of the shock situation, then you need to make sure that you can get blood supply back into the blocked artery. Yeah. So that one is the second stage. So the first stage is to help the heart get out of trouble. Yeah. Okay. So what's the purpose of the treatment? The main goal, of course, is to get the blood flow back. Okay, and to make sure that in future you do not have further heart attacks. That's very important. Yeah. And prolong life and improve quality of life. So once you got this treated, you're back to your normal self. You can do whatever you want to do: swimming, running, exercising, and things like that. That's very important. Yeah. Okay. So there are two modes of treatment. If you see, one is a bypass. Bypass can be 1, 2, 3, 4, 5, up to 7. And of course, this is stenting or ballooning. All right. So how do we decide which is which? So we have two international bodies worldwide. Every 4 years, we update based on our research data. So one is in Europe. This one is European Association. We have European Association of Cardiothoracic Surgeons or European Society of Cardiology, this one. And the other one is American. Now, which is better? CABG is bypass, PCI is stents or balloon. So if you got one vessel or two vessels, then you can put in a stent. For anything more than 1 or 2, 3 vessels, bypass is the safest and the best long-term option. So many people are misinformed about this because of the fear of surgery. So if you go to a well-trained surgeon who can do his job well, just like you go and repair your car in a proper place, you get good results. If you go to a person who is not really sure of what he's doing, then you may run into trouble, of course. Yeah, so this is very important. Okay. So this is the American version of it. So American version for everything is a bypass because they feel that that's the best in the population and the best long-term results in the world. Yeah. Okay. So why is it the guideline is important? Now this is a patient that has come from Indonesia. Okay. Now if you look at this, there's a block here, there's a block here, there's a block here, and you go further down, blocks here and blocks here. So the doctor there just kept on putting him stents. Put in 1 stent, 2 stent, 3 stent. Finally, the whole blood vessel is full of stents. So he becomes Iron Man. Right? And when he came to us, he was only 52 years old. There's no more place to put any stent because the doctor has already put in everything and made his money. So now he sends him to the next station. He said, okay, go and do your job now. There. So when he comes to us, this was in Singapore, we can't do anything for him. because there's no place to do the surgery anymore. The whole vessel is full with metal. So the only thing that can cure him is a heart transplant, which is obviously not going to come, not for a foreigner. And even in Malaysia, I think Malaysia does for 3 to 5 a year. Singapore, we do about 10 a year, but that's very difficult to come by because nobody wants to give their heart. Yeah. So we just let him go and give him medicines, and after about, I think, a year, he passed away. So very young, 52 years old, which can be saved actually. The reason is that once you fill up the whole vessel with stents, there is no place for a bypass, so you become a metal jacket, what we call Iron Man. So when Iron Man comes to us, we can't help him anymore, yeah, unless we get a new heart or a new artificial heart for him. And this is very important. When you meet your doctor, if he tells you that he's going to put 4 or 5 stents, then you better get a second opinion. I'm not a policeman for anybody, just telling you the truth. If he's telling you you need more than 4 or 5 stents, then you better get a second opinion. Because that is actually not accurate. Yeah, it's not accurate. At the most you can put in 2 or 3, not more than that. Yeah. Okay. So these are just some studies to show you. This is this year, 2019. Okay. So the bypass is in blue, and the stenting is in red. So if you go up, you're going to die in the long term. If you're down, the chances of you living is longer, is higher. So just to make it in simple terms. So you see, bypass is actually better than stenting. But the problem is everybody's got this perception that bypass is dangerous. So they don't want to go for that. They don't want to have the surgery. They say, oh no, I just put in a stent. Yeah. So one day the problem will come. One stent will lead to another stent, so you become a frequent flyer. Yeah. Okay. Now this again is a long-term mortality. So there's benefit of bypass over stenting, especially in diabetic patients. Yeah. So it prolongs life, it's better long-term results, it's safe, it's better, and of course it lasts longer. Yeah. So the stenting, once you put it, even my own father, because he refused surgery, so he put 1 stent, after 3-4 years another stent, after 3-4 years another stent, so finally he had to go for surgery. Yeah. Okay. Now there's a lot of fake news about bypass, that it's complicated, it's risky, it's difficult, best not done, it's dangerous. Actually, it's the most common procedure done, and the risk in a good surgeon's hand is only about 2%. Yeah, and the best outcome is for artery, for coronary artery disease is always bypass. And nowadays, modern technology is not what it was 20 years ago. 20 years ago, the surgery was dangerous, but nowadays it's very, very safe. Yeah, it's very safe. Okay. So this is how we do it. Usually we go through the front. There's a bone here that we need to cut, but everything is on the inside. On the outside is just one line like this. You can also go through the side depending on the indication. And once we do the surgery, the bypass, all done in one go. You can do 3, 4, 5, 6, 7, how many you want, and after that we just close it up. So the surgery on the heart is actually only 90 minutes. But the preparation, when you go into the operation theatre, the doctor who gives you anesthesia, puts you to sleep, puts some lines here in the neck, the blood vessel comes down to monitor the pressure in the heart and things like that. We clean, we start, we clean, we close up, bring you back to ICU. That will take an average of 4 to 6 hours. So my job is only 90 minutes on the heart, yeah? Not more than that. Unless it's a very complicated procedure, that's a different story. Yeah? But generally, it's only 90 minutes. So this is the team in the theatre. Okay? Yeah, the slide is run out a bit, so excuse me for that. So we have this special machine called a heart-lung machine. This machine will take over the function of the heart and the lungs when we do the surgery. So all the blood is diverted into this machine. There's a specialist that runs this machine and controls everything. Yeah, everything is computerized and safe. And there's a team of people doing the job, right, while the machine is on. Yeah. Okay. So during the surgery, we need to take some blood vessels from the legs. So we can either do it via a scope, all right, or we do it through some small incisions, small cuts. So this vein from the leg is not in the leg and it's not going to incapacitate you or stop you from walking. It is the one just under the skin. It's just 3 millimeters under the skin. And God designed this vein for bypass. Nothing else. Nothing else, trust me. Nothing else, yeah? So, and after surgery, usually you can walk after a day. It's not going to be that painful. The only pain relief you require is Panadol. And you can walk. There will be some bandages on the leg. And the chances of wound infection is about 2%. Yeah. There will be some swelling, of course, just like you fall down on the floor, you get some swelling on your knee, and some swelling in the leg, which will usually go off within 5 to 7 days. Yeah. So sometimes for a young patient, we need to get blood vessel from the hand. So God again has been kind. We've got 2 blood vessels in the hand. Yeah, okay. So to make it simple, we take the one on top. So this one lasts longer because it's an artery. So anybody 40 years and below comes for bypass, we usually recommend this because this will last very long. Yeah, okay. Now this is the surgery, so we can do as many bypass as possible. So why is surgery better? If you look at this, concentrate on this one. So when you have a disease, your stent is going to come in here, this one here. That means disease is still there, the yellow color one, but the stent is coming here. So sooner or later, it's common sense is going to tell you the disease, there's no cure, it's going to continue and block your stent. But the bypass, when you do, you can choose an area which is clean, free of disease. So that means it bypasses the disease area here. So when you do the bypass, you're back to normal blood vessel as it was before the disease. So that's why it lasts longer and it's better outcome compared to the stent. Yeah, this is very important to know. Okay. Now this is how it looks like in the theatre. So this is your heart, it's the size of the fist. So we open the chest and the surgeons are doing their work. Alright, so you can do the bypass. You can see the blood vessel is very small. It's just about 1 millimeter to 2 millimeters. So we use special glasses to have a look at it. And this is the bypass already done. Okay, the vein, this vein is from the blue one is from the leg. We have taken it and put it on the blood vessel. So we have a mechanism to check to make sure everything is okay. We check that the bypass are all functioning well. Yeah. Okay. Before we close and come out from the operation theatre. Alright. So this is what happens 6 hours after surgery. If you concentrate on this. These are 6 hours after surgery. Everything is okay. The tube is out from the mouth, can eat and drink and normal, rest in bed and talk. This is day 1, this is second day. After surgery, today is surgery, this is tomorrow. Usually we start the patients walking, yeah, and then we got specialist physiotherapists to help you go up and come about doing your usual activity. Yeah? So it's not an impossible or completely dangerous surgery where you cannot leave the hospital and things are going to go bad. So if you come positive, optimistic, you get good results. Yeah? Of course, nobody can play God. There is a 2% risk, and what is the risk? Of course, infection of your wound, where you have the cut, some urinary tract infection, some lung infection, some water around the heart or the lungs where you require a second procedure, you have some bleeding, we need to take you back to operation theatre to have a look. You may have organ failure, the bypass may fail, and of course death. So all this is about 2% on an average. So there is a more than 95% success rate of this surgery. Yeah. Now we come to the next part, is the valves in the heart. So there are 4 valves in the heart, as I mentioned. All of them can be repaired or replaced safely here. Okay. So these are the valves. 1, 2, 3, and another one here, 4. Yeah. Okay. So valve usually what happens is they either leak, okay, or they become small, stenosis, they narrow. The reason this happens is because you have diseases. The diseases are basically infection, or from birth you have some problem, or due to aging. Now this infection is very important. Those of you who've got holes in the teeth, you should visit your dentist and get it filled, or if not, replace it with dentures or whatsoever, because that's the commonest source of infection. So a lot of people who do not go to the dentist regularly, got holes in your teeth, when that gets infected, the infection can drop down to affect the valve. So that's why once the infection drops down in the valve, it will destroy the valve. So that's very important. Yeah. And of course, if you got it from birth, this one usually the doctor would have detected it and told you that you got something wrong with your valve. Sometimes you just observe it, but it comes to a point where you will need some intervention to be done. Degenerative basically is old age. So when the tissues become frail and old, you have problems with the valve. Sometimes you have calcium deposition. All that needs to be removed with either a new valve, you replace it, or you can repair it. Yeah. Okay. So what happens to people who have valve disease? Basically, they are in heart failure. They become short of breath, become very tired. Rarely you have chest pain when you have valve disease. You don't have chest pain when you have valve disease. You have swollen legs, you get a normal rhythm. And sometimes you just leave it alone, you just come to the hospital, all collapse and death. Yeah. Now, very easy to investigate this heart problem. ECG would tell, X-ray would help, and echocardiogram would confirm the diagnosis. Okay. So all these are painless, and I think this one is maybe in some places, I don't know what's the cost. I think 30-40 ringgit. This one is maybe also about 15-20 ringgit. This one is a bit more expensive. I think 300-400 ringgit. But it saves lives, huh? Yeah. So this is the echo. It's just a scanner. Like when most ladies are pregnant, you go to the gynecologist or obstetrician, he does a scan of your baby. This one we do the scan of the heart. So we can see which chamber is affected and which area needs to be repaired or changed or addressed. So all the measurements can be gotten accurately. So there's 2D, 3D, 4D, 5D, now there's even 6D. Yeah. Okay. So the treatment is pretty simple. If you got a mild heart disease, mild leak or mild narrowing, then there's nothing. If you are moderate, then you probably take some medical and follow up. If you are severe, then of course you need some intervention to be done. Now what is the intervention? Intervention of course is surgery one. The second thing is transcatheter. Now transcatheter meaning you do not need any cut. So you can do it like how you do angiogram. So when I was in Singapore, we did a lot of this, but the problem is only the valve is 150,000 Sing dollars. So that's about $500,000 ringgit. Insurance do not cover this because it's super expensive, and we do not have long-term results for this. Yeah. So what we do is we put it for all the patients who are having terminal disease, who keeps on coming in to the hospital with heart failure, to allow them to spend more time with the family at home, and the family can afford and can pay and they want this, then we offer this to them because they're all about 85, 90 and things like that. They cannot afford surgery because of their health, and of course they still want to live for a few more years, so we offer them this. In Singapore, the program runs, the government does not sponsor the money, so we get the funds from a rich businessman, so we do about 20 patients a year. So the moment he stops giving money, the program is also gone. Yeah, because now it's very expensive. But if you are in America, Europe, Australia, it's all free, covered by the government. Malaysia not covered. IGN does this, but also you have to pay. I think in IGN it's about 300,000 ringgit, yeah, something like that. Yeah. Okay. So this is how it's done. Okay. So you make a puncture in the blood vessel here at the groin, at the thigh area. You bring it in. Yeah. You bring it in. So everything is just like a collapse. When you get the valve across the valve, artificial valve across the area of interest, then you just inflate it. So this is how it will look on the inside and how it will look on the inside. So it's like a 2-hour procedure and no surgery, and next day can leave the hospital. Yeah. Okay. Now if we decide for repair or surgery, these are the type of the valves that we have. We have a mechanical one. This one is made of titanium, so the aeroplane material is similar to this. So you can walk through any security in the airport, it will not alarm. This is tissue, so this one is called cow, pig, horse, or mixture of either one. Yeah, but this one only lasts for about 10 to 12 years. So if you use this, you will need a second surgery sometime in the future. If you use this will last you for your entire life, but you have to take a blood thinning medication. And the blood thinning medication, you have to modify your lifestyle. You cannot do vigorous sports, you cannot play rugby, because each time you have a cut, you're going to bleed more than normal. So there's a risk of bleeding in the brain, in the belly, in the leg. And for any cuts, or if you're shaving, you have a cut, you bleed more than normal. Yeah? But the only advantage is that one surgery will sort it all. You won't need a second surgery. Yeah. Okay. And these are rings. Suppose we can repair. We generally try to repair first. So there are special rings of different sizes, and also special material, thread material we can use to repair the damaged valve. Yeah. So the first preference is always repair. If you cannot repair, then of course we have to replace. So these are the surgeries cut that we do. So actually it's just from the top to here. Yeah? So this is about 10 to 12 centimeters. It's not from top to bottom here, as what many people think. We can also do it through the side, but this one depends on the disease you have. If the disease is suitable, then we can do it by the side. So this is about 5 centimeters. This is about 12 centimeters. Or we can do it smaller. This is about 6 centimeters, yeah, from the front. But this will depend on the type of disease you have. Not all patients can go for this, what we call minimally invasive surgery. Generally, they are by this way, yeah, okay. And the pain, if you take 0 as no pain, 10 as the most painful experience ever. So childbirth and pregnancy is 9 and 10. This operation pain is 5. With the Panadol, it will go down to 1 or 2, or sometimes even no pain. Yeah. Yeah, I'm talking seriously, not joking. Serious. Yeah, so you should be well informed. You can go any hospital, they only give you Panadol. Yeah. Okay. So the third part is this what we call aortic problem. Now there is a major blood vessel coming out from the heart. So this one is called aorta, right? This one. This is a medical term. Yeah. This is the biggest blood vessel coming out from the heart and in the body. So generally, once it comes out from the heart, there will be branches going up to the brain. So when you have stroke, these branches are affected. Okay. But generally, this can either tear or rupture, or it become big, become swollen. So when it becomes big, or ruptures or tear, if you reach early in the hospital, you need the surgery to sort this problem out. Yeah. So most of the time, this problem is that you get some pain, or sometimes it's just during screening. You go for an X-ray or you go for a CT scan, you find a big bulge in the X-ray. When you do investigate further, then you find that there is a problem with this. Yeah. If you are dissected or you're ruptured, then you have to reach the hospital fast because the chances of surviving from this is pretty low. Yeah. Okay. So if you work in a place like Singapore, because it's so small, so many patients actually they are lucky that they reach the hospital early. That we can save them because it's very small, not to sound 34 kilometers. Yeah. Now these are the scans. If you see, this is the blood vessel that is swollen and big. It should be this size. Yeah. So now it's like almost 5-6 times the size of this. This one is all swollen here. So this one all needs surgery because if you leave it alone, it will rupture and you will die on the spot. Yeah. Okay. Now this is what we do. So we have artificial material to replace the disease segment. Yeah. Okay. Same like this. So we have artificial material, and all this material will stay in your body forever. They are harmless. They will not cause any issues except for 1 or 2% chance of infection and things going wrong. Yeah. Okay. Now the last one is hole in the heart. This one is very common in the newspaper. People asking for donation to get the surgery done. So hole in the heart usually is a kiddie problem, but you can actually live up to your adulthood with a hole in your heart. Because you will not know until you become tired or you have some problem, then you go to visit the doctor and he detects it with the echo. So the echo can detect where the hole is. So once you know where the hole is, you can actually close it. So the operation is only 1 hour and it's pretty straightforward. So you just close it with a patch. This is a patch, this is the hole. You can close it with the hole. Yeah? Okay. Now, heart surgery is safe, yeah? So I hope I convince you, but nobody can play God. There's no doctor who can tell you that 100% I can do the job. If he's telling you that, he's bluffing. From my personal experience, in 1,000 patients that I do in 2 years, that means every 2 years we have a quality check to make sure the doctor is doing the right thing. In Singapore, it's every year. And we have to keep in the percentage of international standards that we have that complication going. Otherwise, they will stop you and ask you to go and either retrain yourself or give up your job. Yeah, so that's very important. Yeah, but nobody can play God. There's even the best surgeon in the world has got deaths. Yeah, okay. So there are many options. There are minimally invasive. There's conventional standard. Basically, they are all safe and pain can be easily managed. And you can get out of bed even day 1 after surgery. Yeah, and usually the hospital stays about 5 to 7 days. Yeah, and nobody keeps you for 10-15 days unless you got a complication or problem. But generally, if you come in with an optimistic mind, everything goes on well. That's what we feel as surgeons. Yeah. Okay. So heart surgery is like Formula 1. So we are the drivers, but we got a lot of people to assist us. So everybody has to play a role to make sure that everything functions very well. Yeah. Okay. So this is just some things about Sunway that you should know. That we've got this latest machine. This machine even Singapore do not have. Just to let you know, first in Southeast Asia. And the operation theatres, when I came back and I saw the facilities here, I was pretty impressed. Just to let you know that these are same like Singapore. So you shouldn't feel that you are in a lesser place. Yeah, okay. And this is something that even Singapore doesn't have. It's accredited by Australia. Yeah, I was there in Sydney. So Australia accredited Sunway. We've got programs with Cambridge. And if you see Cambridge and Harvard, they are the top in the world. Yeah. And these people, Royal Pebble is one of the leading centers in the whole world. They're from Cambridge. I've been there before. They're usually very picky and classy people. They do not come out to merge with anybody. So it's a big honor for them to come out. Because we tried to push them from Singapore, which they refused to come. But somewhat they managed to agree to come to Malaysia, so it's a very big thing. So in Europe, Cambridge is number 1. Yeah, always number 1 or number 2. And we also got this program with Harvard. So Harvard also is one of the universities that will never come out. They are very traditional and they believe that they are the best and they do want to come out. So but they somewhat decided to have a program with Sunway. So it's a good place. Yeah. That's it. Thank you.
All right. Thank you, Dr. Hardip. Okay, doctor is quite rushing today, so if you have any question, you can ask now, because after the talk, doctor will go back straight. Is there any question?
Yeah, feel free to ask, don't be embarrassed. Can I ask?
Doctor, thank you very much for the briefing. It's very good, knowledgeable briefing. I'm a heart patient. I got 3 stents with me.
Okay.
What to find out is when I go for surgery, they told me there's few types of stent with various prices.
Yes.
My first question is what to choose.
Yes.
We got no choice.
Yes.
Second question is there a lifespan for stent?
Oh yes.
Yeah, thank you.
Yeah. Okay. So you got 3 stents. So maybe the next. I hope you don't get sick. But if the next time if you do, then you need to consider surgery. Yeah, that's one. Number 2, you say the type of stents. It's just like you got BMW, Mercedes, Ferrari, Porsche, everything. So it depends on how you can choose it and how much you can afford. Of course, it's very unfair. As a patient, it's very unfair if you put through this. But this is not put by Malaysian government or Singaporean government. It's by the people in America, US, Australia, and Europe. They have put the trend this way. So that's why if you look at the news these days, they are fighting in Canada, especially. They are fighting for all this. They don't want the medicines to be priced at different range. They don't want medical products to be at a different level. So everybody, if suppose everybody needs medical care, it should be Ferrari, not Proton or not Fiat or not different models. Yeah. So that's a sad fact that is going on worldwide. Yeah. Okay.
What's the lifespan for this stent?
Well, usually the lifespan is depend on how well you control your risk factors. That means if you have diabetes, you have to control it well. You have blood sugar, blood pressure, you have to control it well. You exercise, your diet, and things like that. The longer you control, the better it is. If you do not control, then you have problems within a year or 2. But if you control well, then generally it can last you about 10 years on an average. Yeah. So the bypass, the longest bypass so far in the world is gone beyond 45 years. Yeah, they just declared that a few months ago. So it's very important that you get the correct information. I give you one example. The person who is leading the country now, the first time he had a heart attack was in 1986, right? So he was given the option because he holds a very important position, no surgery, can go back to work fast, whether to do stent or whether to do bypass. But he's a doctor, so he knows which is longer lasting. So he opted for a bypass. It lasted him for 20 over years. Second time he had the problem, same thing again. They said, you want a bypass or you want stents? Stents, you can go back. You're already old, you're 80 plus. He said, no. He said, age is not a matter. And he said, age is just, basically to us, age is just a number. If I see you, to me, you look like a 40-year-old, yeah, because your body doesn't tell you age, right? And he decided for a second bypass, and is going on leading the country now. So that's why it's very important to have the correct information. A lot of people do not have that. They have this fear in them that surgery is going to cause problems. So that's not true. But of course, as I said, nobody can play God. There is a 2% risk that you have to take. Yeah.
Is there any more question?
Doctor,
Yep.
I have a family member that undergo the angio, stent, right? So after the operation, of course, he takes some medication, and then after the operation, he then bleed maybe from the sea or
Yeah. So the reason is after these heart operations, whether it's a bypass or whether it's stenting, you need to take blood thinners. So they are usually, you are prescribed 2 types for the first year. So these medications, in some people, they are sensitive to it. So you have some gum bleeding. If you fall down, you have some swelling in your knee or swelling in your elbow. You bleed more than normal. So what you have to do is for small cuts, for gum bleeds, you just have to make sure that you use a gentle toothbrush, that it doesn't scrape your gums and make you bleed. And when you fall down, you have a cut, you have to hold on to it and press it longer.
there should be something normal.
Yes. So after 1 year, they will stop one of the blood thinning medications. You just carry on one for lifelong. Yeah. So the blood thinning is basically with you for life. So you need to modify your lifestyle. That's very important. Yeah.
Doctor, I had a heart check before, and the doctor mentioned that I have this term called sinus tachycardia. So, but they did not, he did not elaborate more whether I need to modify my lifestyle, or he just mentioned maybe because I used to run and run, my heart rate increases a lot. So I don't know whether is it advisable for me, should I control my exercise, or is this something I need to limit in the long run?
Okay. So you have what I discussed just now, arrhythmia problem. So your heart is faster than normal. So you need to see an electrophysiologist. It's called EP, or the full form electrophysiologist. So they will do a special test to map out where the signals from your heart are coming. If they are excessive, there's a small procedure like an angiogram. It's a day procedure. You go in the morning and come out in the evening, where they will burn that area. So once they burn that area, your heart will be back to normal. Yeah, so that's important.
So
Yeah.
there is a need for me to check. Can this lead to, I mean, is it like a symptom or a reason for me to consider for future purposes, or I can?
Yeah, I think it's safer to check. Yeah, if it's negative, then well and good. But if there's something, then you can deal with it. So you can't, for this problem, you can't go to a general practitioner. They will not know what to do. Even the cardiologists you go to must be very specialized. They call themselves EP. Not all hospitals have this. Yeah, not all hospitals. So you have to see that they're called electrophysiologists, because they are in charge of heart rhythm. They specialize in heart rhythm. So you have a heart rhythm issue, so they will know what to do with it. Sunway, we are getting one, I think, in October. That's right. Yeah.
Because I got it checked at Sunday, so perhaps at that time. because
Yeah.
it's many years
Yeah.
back.
Yes, many years back. Yeah. That's important. Oh yeah, one more thing I wanted to tell you that's very important, which the management told me to pass a message to you. The price of the surgery now is changed completely. Yeah? Previously, one open heart surgery in Sunway would cost you about 80 to 90,000 ringgit. Now it's coming down to about 45,000. So it's 50%. So you can go and tell your friends, because we are launching this program. Because we are launching this to help people. So a lot of people, what is happening is, because of the price, everybody is going to the government facility, and the government facility is choked. You know, that they cannot serve you. They cannot serve you, they are choked. So there are many people that were actually dying on the waiting list. So we are just trying to help by bringing the price down. And
But my concern is, apart from the technology, because you mentioned that we have to listen to the doctor's advice.
yes.
Because about 10 years ago, when my daughter was diagnosed with Hawkome,
Yeah.
and we were told this is a time bomb and she has to undergo surgery immediately. So we went to see several doctors in KL, but all say the same thing until when we went to Singapore, and she's 11 and she's still prolonging this surgery. So, I mean, my question is, how do we know whether should we listen to the doctor or not?
Good question. Yeah, so Hawkome is a thing you have from birth. It's a congenital problem, and there are many varieties and aspects of Hawkome. Yeah. So when you discuss with this doctor, the doctor must be number one, doctor that operates on children. I don't operate on children, so I'm not the expert, but I do adult. Adults also have this problem called Hawkome. So basically, there's an excessive muscle in the heart that you need to cut it out, and sometimes the valve may be leaking, one of the valves. So the safest option, of course, for this is surgery. That's why everybody recommends surgery. That's the safest option. You can't go wrong with it, provided a person who can do it well, what we call pediatric heart surgeon, that means children heart surgeon. If you can do it well, then well is good. If you don't want surgery, there is also a group called pediatric cardiologists. They are children that probably detected your daughter's disease, the ones who do the scan. So they can also have a different way of doing it, where they feed in a catheter and burn the muscle there. Okay, that's a safer option, but I'm not the expert in that, so I cannot give you an option because I don't deal with children. Yeah, but Hawkome for adults, the moment I know that there is a Hawkome, I would operate on him. I will not leave him alone. Yeah. Yeah. So you need to check to make sure the pressure measurements and have you got an MRI done? Yeah. So you need to be on the follow-up because it's in the family tree. Yeah. So if you go to see the doctor in Hawkome, I think the child specialist in IJN, Dr. Siva, is the expert. You can see him because he operates on children. Yeah, and he's very well knowledgeable about this Hawkome, because Hawkome itself in the Asian population, as I mentioned, is very rare. It's very rare. Yeah, it occurs only in maybe about 2 to 4% of population. Yeah, so so very few surgeons can actually deal with this problem. Yeah. So if you go, you have to look for the right doctor. Yes. Okay.
So we take one last question, yeah?
So the trust say I think the transplant and the problem is when we are having a heart attack. So what we should do at that moment?
Oh, okay.
Nobody can do the CPR
Yeah, if you have heart problem, then if you have chest pain and difficulty breathing, first of all you should sit down and relax. Don't walk around and try to do something, and then call for help. That's the most important thing. So a lot of us, when we have this problem, what we do is we try to exert even more. You try to read something or try to read somewhere or trying to thinking that you're trying to help yourself. Actually, you're not. The first thing you should do is just sit down and breathe in and breathe out. Because the problem now is that the heart is working more than normal and it cannot get enough of oxygen and blood supply. So if you keep on doing more activity, you are depleting more oxygen and more blood supply to the heart muscle. And then you need to get help, get somebody and let somebody know that you're having this problem so that they can help you. The one you say the CPR and all that's different, that's patient already collapsed. So once already collapsed, you know that he's got a heart problem. Sometimes in the shopping malls and the airport, you can fix what you call AED. There's you fix it to the chest. It will demonstrate there is no heartbeat. It will prompt you, give you instructions on how to carry out the CPR, so you can do it if you are trained. Yeah. That's it.
Okay, thank you everyone. So before you go back, don't forget to fill out the feedback form, okay? Alright, thank you.